More than 150 healthcare providers from counties across Florida attended the 8th annual Southwest Florida Immunization Workshop at State College of Florida, Sarasota Manatee at Lakewood Ranch. ABC 7's Alex Redmond joins us with information on how this workshop hopes to achieve. Alex.
Thanks, Haley. Childhood vaccines are routine in the U.S., but some parents may not be on board. Now the Florida Department of Health is on a mission to help medical professionals better understand and communicate with families the importance of vaccinations.
Actually, the recommendation is that they get it before they start being sexually active.
HPV, a topic of the 8th annual Southwest Florida Immunization Workshop for healthcare providers.
The HPV vaccine is for cancer prevention, that it has no sexual connotation.
Darlene Thomas-Brown, Executive Community Health Nursing Director for the Florida Department of Health's statewide immunization program, says unfortunately the vaccine got a bad rap when it first came out.
If you can prevent cancer before a person is exposed to a virus, isn't that better than trying to treat the virus or the disease after exposure?
One of the goals of the workshop, entitled Facing the Challenge, Adolescent Vaccines, is to get parents and kids on board with getting their vaccines.
Children are being left unvaccinated. They're unprotected against some of the huge things that can leave them scarred for life.
Donna Keith, Immunization Program Director of the Florida Department of Health in Sarasota County, says boys often think they don't have to worry about HPV because they don't get cervical cancer. But there are other concerns.
Throat cancer is prevalent among the boys, and also anal cancer. But for us, what we do is show them the genital warts, and they're on board 100%.
Thomas-Brown also cautions people to be aware that there are a lot of myths circulating about the dangers of vaccines, and part of the problem is now the internet.
Passing out has been as a result of needlephobia, where a person hits their head on the way down because they pass out when they see the needle. It has nothing to do with the vaccine.
Keith says meningitis, in particular Men B, has caused deaths in several colleges. But now there's some protection.
We have actually 2 vaccines now for meningitis. We have the quadrivalent meningitis, and we have a new vaccine, the Men B.
Role-playing was a useful tool enabling healthcare providers to experience what being on the patient side may involve, with the hope that this will improve communication and get more parents and kids on board with vaccinations.
And Alex, what about people who are worried about those possible adverse effects?
People that have a health history or have immunocompromised systems may want to discuss things and their concerns with their healthcare provider. But as both Darlene Thomas-Brown and Donna Keith said, that really this is all about preventing things that are much, much worse down the road. So they really do hope that everybody gets on board with protecting their kids.
All right. Thank you, Alex.